Hello, I'm Lisa Martin from HORIBA Veterinary, and I'm delighted to welcome you to our next continuing professional development webinar in our ongoing series. We are very pleased to have you join us today. All of our previous CPD content on a wide range of veterinary subjects is available to watch back at any time in the support section of the HORIBA Veterinary website. Firstly, I'd like to introduce you to our speaker, tell you what to expect from the webinar and a little bit about HORIBA. We're very pleased to be working today with Charlotte Russo, Specialist Registered Veterinary Nurse at the Transfusion Centre at the Queen Mother Hospital for Animals, Royal Veterinary College. Charlotte will be speaking on and answering your questions on blood transfusions in dogs and cats. Charlotte graduated in 2008 from Morton Morrell College with a foundation degree in veterinary nursing and practice management. She worked for the next year in general practice before moving to the Willows Veterinary Centre and Referral Service in the Midlands in 2009. During her 5 years there, she gained her diploma in advanced veterinary nursing, studying medicine, intensive care, anaesthesia and analgesia. In 2014, she moved to the Royal Veterinary College to run the Transfusion Medicine Service and Blood Donor Programme. The service has expanded significantly over the last 8 years, where it's now one of the busiest veterinary blood transfusion services in the world. Charlotte is the head nurse for a team of 3 transfusion medicine nurses and a transfusion assistant, and works with a team of veterinary surgeons headed by Karen Hum, Programme Director. Charlotte has lectured, contributed to transfusion medicine research and authored a chapter in the Manual of Veterinary Transfusion Medicine and Blood Banking. She's always found transfusion medicine fascinating and extremely rewarding, and over the years has developed a passion for feline transfusion medicine and donor welfare. HORIBA Veterinary sits within HORIBA UK with expertise in scientific testing, mass flow controllers, automotive emissions and air and water quality testing. HORIBA Veterinary and HORIBA Medical are a well-established provider of laboratory diagnostic instruments. We work with reference laboratories, academia and general practice and specialist settings. Our veterinary product range currently includes handheld meters running single parameter tests, higher capacity, user-friendly automated instruments and the first fully integrated in-house PCR testing system. Here's a brief introduction. Our Lacqua Twin handheld meter range works in seconds on small sample volumes for individual parameters including ionised calcium, pH and electrolytes, and all can be used patient-side. HORIBA offer benchtop systems for clinical chemistry testing, from occasional use to specialist, large, reference laboratory throughput with the benefit of small sample volumes, offering highly cost-effective solutions and bespoke profiles for esoteric and project testing. We also provide instruments for immunoassay and blood gas analysis. The Pocket Central PCR analyser is a unique, easy-to-use benchtop system which integrates seamlessly with your current lab provision. Within reach of all veterinary settings, each step of the PCR process is fully automated and can be run by any trained member of the practice team 24 hours a day. Results are available in under 2 hours, speeding up diagnosis times, informing prescribing decisions including responsible use of antimicrobials and aiding patient and site management. The Pocket Central test range includes over 190 assays, enabling fast and easy testing for common and exotic bacteria, viruses, parasites and protozoa across small animal, farm, equine, poultry, aquaculture and environmental work. Easy PCR testing for all species is now accessible for everyone. Should you have any questions, please write your query into the box on the screen and we will cover as much as possible at the end of the webinar. If you're watching live and you would like HORIBA to issue you with a CPD certificate of attendance, please provide your name and email address in the box on the screen and we will send this on in the next few days. You'll also have our contact details at the end of the webinar for any further queries or if you are watching back. The event recording will shortly be available to view via the HORIBA Veterinary website, and you'll be sent details to enable access for you or any interested colleagues. So now I'd like to hand over to Charlotte for her presentation on blood transfusions in dogs and cats.
Good evening. Thank you so much for joining me this evening and for giving up your time to listen to my talk. As Lisa introduced, my name is Charlotte. I've worked at the Royal Veterinary College now for coming up to 11 years. And ever since I've been here, I've worked within the transfusion medicine service and our hospital-based blood donor programme. I'm fascinated in all things transfusion medicine and blood donor, and I'm hoping that you'll find my talk interesting. I've actually got quite a lot of content in it, so I apologise if I feel like I'm flying through it a little bit, but if there's anything that you want a little bit more detail in at the end, then I'm more than happy to answer some questions. So what we'll try and cover this evening, if I don't run out of time, we'll look at blood types and blood typing, choosing your donor, so what makes the perfect donor, the criteria that we're looking for, and then how to perform successful donations. We'll briefly look over cross-matching, who we might be doing that with, when, and why that might be appropriate. And we'll look at component therapy, but to try and fit that in as well, what we'll actually do is look at that in the context of a couple of cases. So to make it a little bit more interesting as well, we'll put all of it into looking at how we managed a feline transfusion patient and a canine transfusion patient and the blood products and the component therapy that we adopted with them. So let's start with blood types. So when we're talking about blood types, we're actually talking about how we classify blood based on the presence or the absence of specific antigens. So these species-specific genetic markers are on the surface of red blood cells. And there's many blood types that we kind of recognize, but if we look at dogs to start off with, the most commonly recognized or the internationally recognized blood types in dogs is based on a DEA classification. So that stands for dog erythrocytes antigen system. And within this blood typing system, this is just the most widely kind of researched and recognized system. There's potentially many other blood types with dogs, but this is the most widely accepted and understood set of blood types. And there is 7 amongst this, but actually number 1, DEA1, is the only one that we really carry much kind of significance with, and the only one that we commercially blood type for in the UK, and that's because DEA1 is clinically important because it, in terms of reactions, it's highly antigenic. So although there is many other blood types within this DEA system, number 1 is the one that kind of stimulates the most antigenic response and therefore can potentially be complicated with transfusion reactions once sensitized by it. So we only type for DEA1 currently, but obviously, as I said, there are multiple other blood types, and dogs have the capacity to carry multiple of them on their red blood cell. But with dogs, we're looking at only typing them for DEA1. And when we do that, we say they're either DEA1 positive if they're carrying this blood type, or DEA1 negative if they do not express the DEA1 antigen on their red cell. So those dogs that are therefore DEA1 negative and aren't carrying number 1 are considered universal donors because they don't carry this really antigenic blood type. And so therefore we say that these dogs their blood has the potential to go to any dog of any blood type, which makes it extremely useful. But it also means as a patient, we don't really want to sensitize them to DEA1. As a patient, they should technically be having DEA1 negative blood themselves. One thing to note that's important with dogs is that they do not have naturally occurring antibodies. And actually, that's a little bit of a blanket statement and potentially a little bit of a lie, but it's an easier statement to put with dogs because there is actually some naturally occurring antibodies, not to DEA1, they're not born with naturally occurring antibodies to that, thankfully, but they do have other naturally occurring antibodies. They're just not clinically relevant at all. They're pretty insignificant. They don't really cause transfusion reactions, and so we don't really concern ourselves with them. So it's just easier to say that dogs don't really have naturally occurring antibodies. And so you may have heard their statement that dogs can have, for their first ever transfusion, they can have a blood transfusion of any blood type. And that is technically correct. It's safe for them to have a blood transfusion of a different blood type to their own for the first time. The only problem with that really is that you are then sensitizing them to blood types that are different to their own. So especially those dogs that are DEA1 negative, and you were to give them DEA1 positive blood, they're then being sensitized to that. So they are coming into contact with a blood type different to their own, and although they don't have those naturally occurring antibodies, so the transfusion hopefully therefore goes successfully and safely. Within around about 4 days onwards, that's how long it kind of takes the body to start having a response to this foreign antigen. It will start to produce antibodies, and gradually those red cells will start to be removed from that dog's system. So the therapeutic response from giving a dog, or giving anyone really, a blood transfusion that is different blood type to their own, it isn't the most therapeutic thing to do, because especially if you have an animal that's non-regenerative, within about 5 days the red cells are going to start to be kicked out, that PCV is going to start dropping, and you might need another transfusion. So always best where possible to give type specific, even to dogs. But yes, there's the caveat that they can have any blood product for their first any blood type for their first transfusion. You may have heard of a blood type called DAL. I'm just going to mention it briefly because it can cause some problems now and again. DAL is a common blood type, so actually they think about 99.8% of dogs actually carry the DAL red cell antigen on their red cells. So actually it's very rare for a dog not to have it. The problem is if a dog doesn't have it, as we experienced when this blood type was first recognized in a Dalmatian, was that the dog had had a blood transfusion from a DAL positive donor, and then subsequently needed a further transfusion a few days later, and was incompatible with every other donor, because it turned out that this dog was DAL negative and had received DAL positive blood, and now had antibodies for the DAL blood type. And so all the other donors, because it's such a common blood type, actually had DAL positive blood. So DAL is only really a problem or something to be aware of when you maybe have a patient that you are having some serious kind of incompatibility issues and struggling to find a suitable donor. There are some breeds of dog that are considered to be to potentially be more likely to be DAL negative, which is Dalmatians, Mastiffs, Dobermans, I think Shih Tzus, although I'm not sure they'd make great blood donors, but they are some of the breeds that can be more likely to be DAL negative. But even then, it's quite rare, even within those breeds. I think only a handful, maybe 4 or 5% are supposed to kind of be DAL negative. So hopefully it's not something you'll come across, but it's just one of those things to be aware of if you're struggling with compatibility issues. There are breed patterns also with blood types. So if you're looking for a particular blood type in a dog that you need to call a donor in, then there's certain breeds that might help you out with that. So DEA1 positive dogs, we often see that with golden retrievers, with poodles, and then Rottweilers, and then DEA1 negative donors or dogs tend to be greyhounds, German shepherds, Staffordshire bull terriers, flat-coated retrievers, Airedales. So there is a list of dogs that kind of fit within these kind of breed patterns for blood types, so that can be quite helpful when you're searching for a certain blood type. Then if we look at cats and their blood typing system, obviously a little bit more awkward, as they tend to be when it comes to veterinary medicine. But the most recognized or internationally recognized blood typing system for cats is known as the AB blood system. And there are 3 blood types within this, not to be confused with human blood types. They're very different and species specific. But the 3 blood types within this grouping system are A, B, and AB. A is significantly the most common blood type in cats worldwide. So in the UK at least, about 75% of cats are suspected to be type A. Type B is less common, around 20 to 25% of cats. And then type AB, which is where they're carrying both red cell antigens, both A and B antigens on their red cells, are much rarer than that. So only about 2 to 3% of the cat population. Some countries hardly see it at all. And so those are the kind of the three most commonly talked about blood types with cats, and the ones that we commercially type for currently. The thing about cats, again, that makes them incredibly awkward and why they are incredibly type specific is because they have naturally occurring antibodies. So within a few weeks of being born, cats will develop antibodies to the blood types that are different to their own. So our type A cats are going to have anti-B antibodies. Interestingly, with type A cats, however, this anti-B antibody generally isn't in really high levels, and some A cats actually potentially don't express or have this antibody at all, and it's not that strong. It doesn't cause significant issues, but it has varying levels in the type A cats. So some could have a lot, and some could have very few antibodies there at all. Our type B cats carry anti-A antibodies, and what we know about type B cats is that all type B cats will have anti-A antibodies, and they are very strong and in very high numbers. So it has been reported that even 1 ml of type A blood to a B cat could be fatal. So that's why it makes them so type specific. Our AB cats, however, because they express both the A and B antigen, don't have any naturally occurring antibodies to those other two blood types, because they obviously carry them. So when it comes to transfusing these cats, A cats should always have A, B cats should always have B, but our AB cats are a little bit of a difficulty because they're so rare that it can be really difficult to actually find an AB donor. And so what you would be looking at doing potentially then when you're struggling is looking maybe towards the type A cats. You would never give them type B, but you can give them type A. And the most ideal scenario with that would be to cross-match them, or remove the plasma at least, where all those kind of anti-B antibodies that type A donor might have are going to be found. But if you cross-match a type A with an AB, you can try and get the most compatible type A donor for your AB cat. And with that being said, therefore, there's no universal donors in cats because of this type specific nature. You may have heard of another blood type with cats called MIC. This was kind of first recognized, I think, in around 2007, and it was named after a cat called Mike. So it's the kind of opposite way round of Dal with dogs, in that Mike he was a transfusion naive cat, and he had a blood transfusion, and he had an acute hemolytic transfusion reaction. So he had a type specific blood. He was type A, given a type A transfusion, and he had an acute hemolytic transfusion reaction on his first ever transfusion. And so he then needed to be cross-matched for any further transfusions because of this worry. And he was incompatible with nearly every single donor. And what they discovered was that he had a very rare blood type, which is now named MIC after him. But all the blood donors had the antibody for it. So because naturally occurring antibodies in cats, they were all born within a few weeks, they developed these anti-MIC antibodies. And unfortunately, Mike or Mick, he actually didn't, he had this blood type. So he carried the MIC antigen on his red cell. So it was very difficult to find him suitable blood because the antibodies are so common. Recently, there has been some new blood types recognized and described in cats, and they've been called FEAs, so feline erythrocyte antigens. They described 5 of them, and at the moment, we don't really know their clinical significance. There's probably going to be a lot more research coming out about them, and actually, I think they have potentially consider FEA1 to potentially be MIC. It's showing very similar kind of characteristics as the MIC blood type. So yeah, so there'll probably be more development, I think, as time goes on in the blood types of cats and dogs. Again, we see breed patterns with cats. So our type A cats, often we see that with Siamese, Maine Coons, Norwegian forest cats. And then our type Bs often are Turkish Vans and British Shorthairs sometimes. And then type AB is often seen with Devonshire and Cornish Rexes. Although having said that, all our type B and AB donors on our blood donor program are all domestic short hairs. So I think the moral of that story really is that you can never tell. There are breed patterns, and it might help you try and root out the type of the blood type donor that you're looking for, but actually blood typing is the only way to determine what blood type an animal is, and they can throw curveballs. So why is blood typing important? And obviously, since we've kind of reviewed blood types, it's highlighted to us why blood typing is important, especially for cats. And the main reason is patient safety. So we're trying to minimize the risk of an acute hemolytic transfusion reaction. That reaction that is the one that concerns us the most, where there's an incompatibility between the donor and the recipient. And so that would be something that we'd be worried, would happen with a type B cat receiving A blood because they have the anti-A antibodies. So blood typing them and giving them type-specific blood is going to minimize the risk of this quite nasty and potentially fatal transfusion reaction. We're also, like we discussed with the kind of DEA1 negative dogs, being exposed to DEA1 positive blood. If we're giving blood type specific blood typing them, then we're going to maximize the therapeutic response of that transfusion. And blood products in the veterinary world, thanks to the development of Pet Blood Bank, they are more readily available, but they are still a precious resource. And so we really want to, and also they are not a benign procedure. So we really do want to be minimizing how many blood products we have to give to a patient. So we want to maximize the therapeutic response of the transfusions that we do give. And so that can be done by giving type specific blood, and we need to blood type to do that. And that helps with for consideration for blood bank stock. So as we said, the DEA1 negative dogs really should be having DEA1 negative blood, and so when that stock is being used, because it's a universal blood type and it can technically be used for any dog, often people like to store a unit of that in their fridge rather than having kind of positive blood in there that can only go to positive dogs. But by doing that and by using negative blood on positive dogs, it just means that that supply is less available for those that really require that blood type. And what we also know about DEA1 negative in dogs is that it's actually less common. So 60% of dogs are thought to carry DEA1, so it is harder to come by. So we really do need to be considerate of our blood bank stocks. But blood typing is inexpensive. It's commercially available. You can buy these test kits, and these Alvidia ones that we use, they're so easy to use, and you can buy them from Pet Blood Bank. They are used, can be used on really low PCVs. So we've run them on cats with PCVs of like 4% and still had a very easy result. And they can also be used on cells that are auto-agglutinating. So your IMHA dogs that's blood is clumping all over the place, it will actually remove those agglutinating cells. It doesn't let them pass through the test, but it still allows those kind of free-flowing cells to go through and give you a result. And they're available in singular packs, which is really handy. So if you're a practice that doesn't need to carry a huge amount of blood typing kits, you can just have 1 or 2 kits available without the risk of kind of them expiring or anything like that. So let's look at what would make the perfect donor, what kind of criteria we're looking for. So age-wise, we want them to be between 1 and 9, and actually we can go up to 10 with cats, and really they should be retiring at their 9th year with dogs and at the age of 10 for cats. And this age is just so that we're not having dogs and cats donating blood that are kind of seen to be in their more geriatric years, where they might start to experience more old age health concerns. Dogs should ideally weigh over 25 kilograms, and this is so that we can collect a full pint, a full unit of blood. And our cats ideally want to be over 4.5 kilograms. And although the blood collection in cats that's done in general practice is open collection, and therefore can be tailored to kind of the size of the cat, depending on the volume, therefore that they can donate, A 4.5 kilogram cat is going to give you, or 4.5 kilogram and above, is going to give you a better size unit of blood. And so therefore, again, a better therapeutic response for your patient, because you only get a very small unit from cats and it doesn't have the biggest impact on your patient. And so the smaller the donor you get, the less you're going to be able to collect. And so therefore it ends up meaning that you might have to use a couple of donors. So the bigger the cat, the better, really. Friendly and confident is really important, both for your well-being and for, you know, managing them as a donor when they come into the practice, but also for them, so that the whole experience is as positive as possible, because they're kind of taking it in their stride. They need to have never received a blood transfusion themselves, because we don't really want a donor that's got potentially lots of antibodies that they could be transfusing and targeting the red cells of the patient. And never travelled outside of the UK and Ireland. And that's just because we know about the infectious diseases that are in the UK and Ireland, and we will actively screen the donors for those. But if they've travelled outside and there's different infectious diseases in different countries, it starts to get expensive and difficult to screen them for all of those infectious diseases to prevent your recipient getting one of those infectious diseases from your donor. And obviously they need to be healthy, and because of that, not on any medication. If they end up, you know, at some point being on a course of antibiotics or non-steroidals or anything like that, we just need to be 2 weeks clear of medication before they donate blood, just so there isn't any trace elements of that within their donated blood. So for setting them up for donation, so there's a few things we need to do pre-donation. The first thing would be to do a head-to-tail health check with a vet. So get a vet to come and do a kind of head-to-tail examination, just as they would do kind of for a vaccination booster appointment. And then on top of that, we need to do a hemoglobin or a PCV evaluation. So for dogs, we'd be looking at a minimum PCV of 40%, and for cats, 30%. This is equivalent to 130 grams per litre hemoglobin in dogs and 100 grams per litre in cats. We want to clip the hair over their jugular for dogs, and then also the cephalic for cats, because we will be placing an IV catheter in our cats. And we want to clip a nice smart kind of square clip for them, so that we can see the vein, we can remove any hair, and we can also apply lots of local anaesthetic cream. So we actually apply liberal amounts of local anaesthetic cream. It really does need to be quite a thick layer to kind of really soak in and have a good effect. And for dogs, we would be looking at having a contact time of at least 20 minutes for that to take effect, but 45 minutes really for cats. They're just that little bit more precious about it. But really, all these things we try to achieve in one contact time. So minimize the repeated kind of clinical interactions you need to have with your donor, so that they're not kind of feeling like they're constantly having people coming up and backwards and forwards to do procedures on them. And it means that they just have a bit of downtime where they can relax and calm a little bit. So our donation guidelines and the volume of blood that we can take from our donors. So dogs, we're looking at being able to collect 18 mils of blood per kilogram of ideal body weight. We don't want to be calculating it based on a chunky chocolate lab. We want to be looking at what their ideal weight should be and working out 18 mils per kilogram. Cats can donate 12 mils per kilogram, again, based on an ideal weight. And the interval between their donations can be at least 8 weeks, but actually with cats, it's still kind of recorded as being 8 weeks, but we actually push it to 12 weeks because cats just don't like coming into the hospital as often as that. And so to keep our cats happy and to make sure it remains a positive experience for them, we try and push that back to 12 weeks instead. Your donor skin needs to be free from any complaints, any skin irritations, dermatitis, anything like that that's going to cause be not that comfortable for them for the donation, but also potentially cause bacterial contamination of the blood that you're collecting. We would routinely do a CBC, complete blood count, and a biochem on our blood donors, and we repeat that every year that they stay on the blood donor program. But if you're doing one-off donations with these donors, then we would always suggest that you should be doing a kind of complete blood count and a biochem before they do a donation, just to check that there's nothing, no worries or concerns with your donor. The infectious diseases that we screen for in the UK at the moment are Babesia for dogs, Bartonella for both of them, Mycoplasma for both of them, and then we do FELV and FIV in cats as well. And we're actually just hopefully soon going to be having the new HORIBA pocket PCR analyzer that you saw in the intro. So for us, it's great because we should be having these infectious disease results back within the day or within a couple of hours actually. Whereas currently what we've had to do is wait a good few days to have these results, which sometimes means that our patients have had to have transfusions whilst we've been waiting for these results to come back. And unfortunately, over the years, we have had a couple of, Mycoplasma positive donors. It's come back after the transfusion has been given, but we've always kind of outlined to the owners of the recipients that there is always a risk when we're waiting for these blood results to come back, that there may be an infectious disease present, and it's a risk that sometimes they have to take. One thing that's really important for us, and is a big part of my kind of passion in blood donor or transfusion medicine, is kind of donor welfare and trying to create a positive experience for them. We're very proud of the blood donor clinic that we run, and we have a lot of measures in place to try and create a really stress-free environment for them. So with the dogs, we always encourage the owners to be present where we think that's appropriate. Obviously, if you've got an owner that's terrified of blood, that's not going to be that helpful for you. But generally, we would say that the owners being present is a really supportive and helpful thing. During COVID, it was quite a difficult time for us when we were having to have the dogs coming in without their owners. Some of them took it in their stride, and I think that insulted their owners, but others really struggled, and it was ones that surprised us as well. They really needed their owners there for support. So yeah, we would actively encourage the owners to be present. With the cats, we don't tend to have this. We have it as an option, but they often are in a little bit longer. You know, they have to wait 45 minutes with the cream, and there's just a little bit more involved with them. But definitely less is more with the cats. Every animal is different, and the approach should be tailored to their likes and dislikes. And we always write, notes about how the donation went and what made it easier for us, so that the next time they come in and donate, we know that Fluffy prefers to have her chin rubbed or doesn't like her ears being touched and things like that. Just little quirks and individual things that you can pick up on that just make the experience a little bit better for them. We always try and do, or at our hospital, we've had a blood donation consult room, so it's a quieter area of the hospital. We're actually really lucky, and we've just moved into a purpose-built blood donor clinic at the RVC, so we're separate from the hospital now. Not that we didn't love being in there, but they're a noisy bunch, especially the neurologists. And we just needed to have a quiet space for our donors, somewhere where they weren't hearing other dogs barking, didn't hear the hustle and bustle of the busy hospital. But I can appreciate that that is difficult in general practice. And if you've not got a kind of specific blood donor clinic set up, then it's kind of making do with your consultation rooms. So just try and choose a quieter area of the hospital, minimize outside disruption. So we put these barriers, tapes across, and we put these wet floor signs out that say quiet, blood donation in progress, and often give people a filthy look if they make too much noise. But it really does make the difference of just kind of keeping your donors feeling nice and relaxed, and that they don't need to be alerted to anything. We listen to, or we put the radio on for dogs. They tend to, research shows that dogs actually prefer talking and chats, radio chat shows, rather than kind of music, whereas cats are way more posh than that and prefer kind of classical music, or just music in general is better for cats than kind of talking. We've actually used this music here that was composed specifically to relax cats. It's very weird music. It has like licking sounds and purring and all sorts of things in it, which when you are listening to in the room and someone comes in, it does seem a little bit strange and a bit embarrassing, but it works, and the cats seem to, for some reason, find that music very relaxing. So I can recommend it, but I wouldn't recommend it to listen to in your car. It's very strange. And then just copious amounts of treats and biscuits and love and fuss. and always using kind of calm, low and slow voices. Some owners have a habit to be very anxious or excited about the blood donation, and so they do their kind of higher pitched, excitable voices, and dogs are very in tune with that, and they get excited themselves. And so we're always kind of trying to remind the owners that it needs to be steady, calm, low and slow voices to encourage the dog and cat to kind of stay still and steady. And we recommend that they use their whatever kind of words they use for their stay or down throughout the donation, just to encourage them to stay still. In general practice, where you're not going to have maybe the large blood bag centrifuges, and you're looking at doing blood donation in practice for your dogs, this is the kind of kit you would be looking at doing. It's it's a single bag collection system for collecting blood in a closed manner. And so this is for collecting whole blood. It's not for processing into components. And it is aiming to collect 450 mils, and you can collect plus or minus 10% of that 450 mils. Something that's really important to be aware of is that blood is heavier than water. So 1 gram of water is 1 mil. But 1 mil of blood is not equal to 1 gram. It's actually equal to 1.06. So when you're working out that you're aiming to collect 450 mils, you actually need to times that by 1.06 to get your actual grams of how heavy that blood should be. So you're looking at collecting about 480 grams is going to be 450 mils. And that's really important for when you're weighing your blood during the donation, so that you know when to stop, when you've got the correct volume. Because if you do actually collect less than the 450 minus 10% and transfuse that to your patient, there is a risk of citrate toxicity. So you really do need to be collecting the required volume for the ratio of anticoagulant to blood to be right. Before you start your donation, you need to close this. This seems to be lots of clamps on this line, I'm not sure why, but you need to be closing this blue clamp here, so that when you unsheath your needle, you're not going to have all your anticoagulant running out of your line, or equally air being pulled into your system, because that then is going to creates a little bit more of an open system, and therefore risk of bacterial contamination. So always have that clamp closed before you start. And this bag here, this small little bag, is actually a sample line pouch. And you can run blood into, so when you first start the donation, you can run the blood into there before opening this clamp and letting it into the larger bag, and that can just be so that you can collect any samples that you want to test of the donor. But also, when you first stick the needle, you get something called a skin plug, which sounds horrible, but the needle is quite big, and so there is potential for a reasonable size kind of collection of skin to be collected in your line, and you don't really want that to go into your blood bag, because it's a bacterial contamination risk. So we normally run the first bit of blood, so we'll open the clamp, let the first bit of blood run into there, and hope that we've collected the skin plug, and then we'll allow the rest of the bag to fill after that, so that we've kind of removed that dirty bit of skin to start off with. If you've managed to collect a full unit and you have not exposed it to any external environment, so you've managed to clamp before the needle came out, and you've got a nice bag, and you've managed to seal this line off, that whole blood can be stored for 21 days. Also really useful to know is that, yes, this bag, this kind of main collection bag, is aimed at collecting 450 ml, but actually Pet Blood Bank do have half unit bags that have their anticoagulant in for a 250 ml blood collection. So they're sometimes useful to have in, because it just takes the pressure off a little bit. But obviously, if you've got a large dog, you're going to need a full unit of fresh whole blood. But sometimes useful to have in, because it just means that you're collecting 250 mils of blood rather than having to go for the full 450. If you were to have the donation stop, or the donor started moving, the needle came out, and you didn't collect enough for you to say that that's transfusible because of this citrate toxicity, you can't really reintroduce the needle, because it's not nice to re-stab with the same needle. but your citrate toxicity is, your citrate levels are too high. So what you can do in that situation, especially if you're waiting on the blood and it needs to be given that day, is just go to adopt an open collection system like you would with a cat that we'll talk about later, where you use a butterfly needle and a syringe and collect the rest of your blood by a butterfly needle in the jugular and add it to your bag, or you could even take it from an IV catheter. We've done that with dogs before, to get the volume that you need and top up the rest of your bag so that your citrate ratio is right, and then you've got your unit and it's still usable and it doesn't feel like that it's a waste. Again, if you did start the donation and it finished very quickly, you just lost blood flow or the donor moved and they've only donated a small volume, and you've calculated how much they can donate and they could go again with a fresh bag, then equally you could do that. So preparing for a donation, you need to collect all your materials together. So you need your blood collection bags, so like the one that we've just described. And this can be used for a gravity collection, which is the most commonly routine way of collecting blood from dogs in general practice, and it's the way that people donate blood. And so what that would entail really is the dog being at a height on a table, and then the needle being in the jugular vein and the bag being lower than the table, normally with an assistant sat on the floor, kind of mixing the blood as it comes into the bag with the anticoagulant, and then weighing it on a set of scales. And they will do that throughout the donation until the desired volume's collected. Or most blood banks like ourselves will use a vacuum assisted collection like the picture here. These are just where your unit, your bag, sits within a chamber that's attached to a suction machine. You have a really low grade pressure applied, and it just creates a small amount of draw around the bag so that it doesn't need to be below the donor, it can be at the same height, and it just pulls that blood out that little bit faster to help aid in kind of successful donations, and means the donor doesn't have to stay on the table for quite so long. You obviously need a good, reliable set of weighing scales. Remember that your blood weighs more than water, so calculate what you're aiming to collect beforehand, and make sure that you keep kind of putting your bag on your weighing scales, or this vacuum-assisted collection chamber is sat on top of the weighing scales throughout, so that you can keep an eye on the blood, that it's still coming, and also that you're at when to stop. You'll need 2 assistants to help with a donation. So one to help hold the head, so that it can keep their hand underneath their chin and make sure they don't move too much, and a second assistant for holding kind of legs and giving them a little bit of fuss. And then you'll obviously need somebody to do the phlebotomy. The phlebotomist needs to have thoroughly cleaned hands before the donation starts. And you need to have gauze swabs and bandage material to hand, because if that donor decides to get up really quickly, you want to be able to clamp the line really fast, and so that you're not drawing air into and contaminating your bag, and being able to put your gauze swabs straight onto the donor's jugular, so that you can stop any bleeding, and put a bandage material on a bandage on them, or a neck wrap, because they might want to get off the table pretty quickly. So it can be difficult to hold some of these really big dogs if they decide they want to get down. Surgical skin prep is ideal, so you want to use maybe we use the little ChloraPrep, the Snap ChloraPrep tubes. They work really nicely because they have a really quick contact time, and they tend to have the kind of desired volume in there, and we give them a preparation just like we would for a surgical skin preparation. Your perfect, or the most ideal, donor positioning, demonstrated here by the lovely Finn. I'll just mute that so you don't hear us chatting. But this is Finn. Actually, this is video I think was during lockdown when he was coming in without his owner. But this is the ideal scenario, really, is that you would let your donor get up onto the table themselves. We have an electric table, so we then take the table up to the height that is appropriate for all of us on our backs. Kissing obviously is required with Finn. And then we would turn their hips first to kind of encourage them to roll the way that we want them to roll, and then calmly kind of tuck their shoulders and elbows underneath them and get them to lie in a nice lateral recumbency. And then we have our 2 assistants, one holding the head, the other one kind of just holding limbs so that it doesn't pour us during the donation. Lateral recumbency provides better comfort for the donor. It makes it easier to control any head movements, and therefore prevents kind of needle redirection or trauma from the needle moving around or the needle coming out. and it means that you have the donor higher than the bag for your gravity collections. We do have some dogs that prefer to donate on the floor, but this is really only achievable with the vacuum assisted donation, because the bag is going to be on the same level as the heart and as the donor. This is Teddy, who donated for years actually, but never wanted to go on the table. So we always had to do some weird yoga positions on the floor to get around it where he was comfortable. You can do sternal, sitting or standing donations, but it's just to be mindful with these that it really needs to be with the appropriate donor, a dog that's, you know, generally pretty placid and willing to stay still or have their head elevated for that amount of time. There is an increased risk of movement with these positions, obviously, and it is trickier to keep that needle in situ because naturally gravity wants it to kind of drop out, whereas when they're in lateral, you can kind of almost let go of the needle a little bit. So even if they do move, the needle kind of moves with them, which makes it a lot easier. So when we come to the actual venipuncture, this needs to be performed by an experienced member of the team. It is a large needle, it's a 16 gauge needle, and so you really want to have your donor in a good position. If you're not sure, if you feel like you can't palpate that vein and you're just not sure, it's too big a needle to just go in blindly. So think about repositioning your donor, putting a sandbag or a little foam wedge underneath their neck if you have dogs that kind of have that really hollow neck, you know, your skinny long neck dogs like greyhounds. Sometimes we put a little bit of cushioning, a little pillow underneath their neck to just to be able to find the vein a little easier. But really you want to do a nice decisive puncture of the skin, gentle but decisive once you're really confident that you know where to go. And then you can advance into the vein. I generally don't ever really go up to the hub of my needle. I think it makes it more difficult to relocate your vein when you haven't got any more needle to move. So I would say generally the needle is kind of halfway in and we're within the vein. It should be a direct entry in without redirection. You don't want to be moving and wriggling that needle around trying to find the vein. It's too big, it's uncomfortable for the donor, even with Emla cream on, and it can actually trigger coagulation because of the trauma that's being caused. So it's minimal movements, small redirections of the needle to try and locate your vein, and anything more than that you need to stop and start again with a fresh bag and fresh needle. Once your needle is through the skin, release the clamp on the line that you closed beforehand to confirm the blood flow and know that you're in. And then again, you will reclamp that line once the desired volume has been collected. And you do that before you gently remove the needle and apply a swab with pressure straight away. You want to apply the pressure for at least 5 minutes, but generally we'll apply a pressure bandage or a neck bandage so that we can let them off the table. And because our owners have got a journey to do afterwards, I think they feel more confident just having that little bandage on their neck, and they take it off when they get home so that they are confident in the car journey that they're not going to rebleed. So some issues that you might experience and a little bit of troubleshooting for your canine donations. These are some of the things that often can happen. So you might get a slow blood flow. That can just be, again, positioning of the needle, but it could also be that the donor's blood is very viscous, or they've got really low blood pressure. You might experience vibrations in the line. That's actually more we commonly see that more with the cat donations with a syringe or with the suction assisted donations, where there's kind of a bit more pressure and maybe the suction needs to be turned down, or we need to move the needle slightly. And then blood flow stopped or no blood flow at all. And all of these things, one of the first things I would do is do really minor adjustments with my needle, like minute, like tiny little pulling back slightly, even turning the needle so that maybe it might be that the bevel of the needle is up against the vessel wall, and you just need to kind of rotate it slightly, and then you might find that you get a much better blood flow. Sometimes it can be so positional and you end up you're barely breathing because you're kind of in this, you've managed to find it, but even the slightest movements of the needle stop and start the blood flow all the time. But yeah, for us, we would always say minor adjustments. And if you really don't regain the blood flow, or the blood flow is just too slow and it's starting to clot, then the only thing is to do is stop and come out. When you have unexpected removal of the needle, generally from the donor deciding that enough's enough and they've decided to get up, you just need to clamp really quickly and apply pressure to the neck straight away. And again, as we've said, we have actually the luxury of being able to weld a new needle on, because we have a lovely machine that welds tubing and welds a needle back on for us. But in general practice, you're not going to have this option, and so it's either starting again with a new bag if the volume dictates that you can do that, or as I said before, using a syringe and needle to get the rest of the volume that you need, or completely aborting the donation. And you can get skin reactions as well, as you can see in this picture. This is probably a clipper rash, or where he's scratched at the neck. Some of the dogs are get a little bit sensitive when the local anaesthetic cream's on. I think it feels really cold and breezy around their neck, especially the long-haired dogs. I always find it with golden retrievers. They're always the ones that try and have a sneaky scratch at their neck, and they can so quickly, now that skin is exposed, they can really easily create quite a sore spot there very fast, and it often prevents us from being able to do a donation if that happens, because you don't want to then be cleaning it with a kind of ChloraPrep and making it stingy, and you've got an irritated skin area. So keep an eye on them when you have clipped and embled them, that they're not trying to scratch at their neck. But if after the donation you notice any issues like this, or the owners call the next day to say there's kind of a skin irritation there, we would normally suggest kind of Hibi scrub for a few days, and maybe applying some Isoderm or Fusoderm for a few days to settle that down quickly. If you experience a hematoma during the blood donation, but the blood flow continues and the hematoma is not growing anymore, then you can absolutely continue with the donation if the blood flow is still coming. However, if it stops and it cannot be regained, or that hematoma is just growing, then you're going to have to stop and apply pressure and potentially a cold compress as well to help that hematoma go down. Another complication that you could experience, although I've rarely seen this, I think I've seen this probably in a couple of dogs in the years that I've been doing it, is signs of hypotension or hypovolemia post-donation. There was one dog that did it a couple of times. His name was Raisin, and he just used to get so excited about coming in that he'd lie there doing his donation, wagging his tail frantically, and the minute you lowered the table, he'd just fly off the table, and then he'd stand there for a second and look a little bit starry-eyed, and he'd sit down, and then he'd be fine. And so that's often what we kind of experience, is maybe weakness, pale mucous membranes, weak pulses, and altered mentation. And it's often usually self-limiting, and it usually resolves within a minute or two, just like Raisin always has done. But if it's more significant than that and there's concerns, then a vet would normally recommend replacing the lost volume with fluid therapy and monitoring them for a little bit longer in the hospital. And then we would always follow this up with a call 24 hours later to the owners to see how they're getting on at home. Even if they've not obviously had to have the fluids, they've just had kind of a starry-eyed moment afterwards. We'd call them the next day to just check that there was no issues. Post-donation is the best bit for these guys. They get a nice bowl of food. So we offer them a small amount of bland food, normally kind of a gastrointestinal food, so we're not going to upset their tummy. We try not to offer them too much of this, as they've got a car journey home and they've probably had copious amounts of treats and biscuits already. But it would always ideally be wet food, and we would add a little splash of water to that as well, just to try and increase their hydration. We would recommend rest afterwards for at least 24 hours, lead walks, and a harness to avoid neck pressure. But really, after 24 hours, everything can go back to normal. And whilst they're in the hospital, we want to make sure we've checked the blood donation site, we've applied pressure for at least 5 minutes, applied a bandage if needed for them travelling home. And if there was any kind of hematomas or bruises, then we always apply a bit of arnica cream before they go home. Now for our cats and setting up for them. Always, again, a little bit more involved with them. There isn't really, there's commercially available blood collection kits coming on the market now. But again, therefore, practices that have the ability to kind of process that blood, and some of the other kit systems are not entirely closed. So generally what we're talking about when we look at feline blood donation is an open collection system where the blood is going to be used imminently. So the first thing we want to do is prepare our syringes with the anticoagulant. So as you can see here in this box, I've got the anticoagulant ratios written out for you. We would always advise using a citrate-based anticoagulant. They're commercially available and easy to use, and it's based on a ratio of 1 ml of citrate-based anticoagulant. So we use CPDA generally, but ACDA is very available as well. We use 1 ml of citrate-based anticoagulant per 7 ml of blood. So that's the kind of ratio you're looking for. So your 4.5 kilogram cats and above, we always do a maximum donation of total of 60 ml, and that would be 52.5 ml of whole blood to 7.5 ml of the anticoagulant. We want to prepare all of that equipment before the start of the donation, because depending on whether you're doing conscious or partly sedated or fully sedated donations, even if you're doing fully sedated donations, and the sedation might not last as long as you'd like, and so you want to have all that equipment ready to hand. But for those cats that are that are only having maybe either consciously donating or they've just had a bit of gabapentin or butorphanol, you want noise and disruption to be at an absolute minimum. So getting all your equipment drawn up, your syringes already anticoagulated. And what we would normally advise is scrap the big 160 ml syringe. We don't use a 60 ml syringe for our blood donations in cats because they just create a lot of negative pressure. They can collapse the vein very easily. They really hurt the person's hands who's trying to pull on the syringe, and they're just not necessary. So we would normally adopt a 3 20 ml syringes, as you can see in the picture there, but we even draw up 10 ml syringes as well, so that if we maybe start with a 20 ml syringe and we're like, oh, this blood flow's really quite slow or it's closing the vein, then we can switch to a 10 ml syringe for our next syringe. And all we're doing is, as the blood is being drawn in, and when we get to the end of our syringe, we bend the line over at the top of the syringe, detach our full syringe, put a cap back on it and attach our next one, and continue drawing until we've got the desired volume. We always place an IV catheter, and this is generally, for general practice, it's going to be so that you can probably provide sedation as well, but it's there so that, yes, we can provide sedation, but also if we needed to provide fluid therapy, we would. We used to provide fluid therapy after every feline donation, but we've not long stopped doing that after recent research came out that we actually conducted a few years ago, that showed that there was no difference in blood pressure or recovery or lethargy with cats that had fluids and those that didn't. So we have scrapped giving them fluid therapy afterwards unless there was any concerns of hypotension or hypovolemia. Then we would obviously give them fluid therapy if we were concerned, but otherwise they don't have any fluids and they can go home a little bit quicker as well, which is always nice for the cats. But our IV is always placed beforehand, and we collect all of our pre-donation blood samples from the IV so that we don't have to do a jugular stick before their donation and then another jugular stick for their donation. We will place that IV and we'll collect the bloods for FELV, FIV snap tests, for our hemoglobin and our PCV check. And for any blood tests that we need to do, whether that's blood typing or for their annual tests, we will try and collect all of those samples from their IV before moving on to the donation. So if we look at sedation and what your requirements are for the sedation that you're going to choose, you want something that's got a short onset but with adequate depth and duration of action. You want something that's going to give you a smooth recovery with minimal cardio or respiratory depression, and something that's going to allow them to resume normal behavior shortly after the end of the sedation. Any sedated donor will always have eye lubrication applied every kind of 35 to 45 minutes to ensure that we protect them from any corneal ulcers and dry eye. But actually for us, our first step with sedation would be gabapentin. And when we're signing up blood donors and assessing them based on their temperaments, those cats that we just think are maybe a little bit slightly more anxious or maybe haven't had the best car journey, or find that we just think they're a little bit more fidgety than would be necessary for a conscious blood donation, we'll send those cats home with a gabapentin tablet, normally a 50 milligram, unless they're a big Maine Coon, then we might go for the 100 milligram, but our general protocol is a 50 milligram gabapentin tablet, and we would advise them to give that 90 minutes before the car journey. There's been some lovely research about how effective gabapentin is for cats and stress for coming into the practice, and we give it routinely to our cats and cat ward as well when we think they're a little bit stressed. So gabapentin sometimes is actually all our donors need, and so we will give them that, see how we get on with clipping and emmularing and placing IV catheters, and if it looks like that cat's going to be that's going to be enough, then great. If not, then our next step would be introducing butorphanol at 0.2 mg per kg, and hoping that that's combined with the gabapentin might be a really nice combination and be enough for our donor. And to be honest, that's generally where we kind of stop. But again, we are choosing our donors based on kind of their temperament and doing a screening process here, and we're actively looking for cats that can consciously donate, because we do stored blood donations. So we actively need cats that are going to be able to do donations without sedation, because you cannot sedate an animal for blood products that are stored. So that is generally where we would stop. If we have to go for a full sedation, these are the protocols that we kind of have in place. So, and really for us, it's protocol 1, and we've never really had to use the others, but I've put them there for you just because general practice and you know, the busyness of your practices and the emergency demand that these blood donations might be being performed in, sometimes you just don't have the luxury of 90 minutes before car journey giving gabapentin and then trying a bit of butorphanol. Sometimes it's like, you know, we need that blood within this hour, and so protocol 1 is really nice. We would give midazolam and ketamine with that butorphanol so that we have a nice smooth recovery. That generally gives us the perfect amount of time for our donation. Some cats have woke up pretty quickly from that, so that's why I always say have that equipment ready, but you can top it up obviously if needed, but for us that generally is more than adequate. You want to have close monitoring of your donor during and after the donation whilst they're under sedation. So looking at mucous membrane colour, their temperature, pulse and respiratory rate throughout both the collection and afterwards. But my main thing really with sedations is choose the sedative option based on the donor's requirements, because honestly some of these, you know, we've got some amazing cats that come in and we always think, why would we give this cat sedation? There's just no need for it whatsoever with some of these cats. They are some of them, I think we just have to give them the benefit of the doubt sometimes. They're not all spicy. Including this little guy, actually. This is this is Imola, one of our blood donors who comes in with her sister to donate. And so for the collection procedure for cats, you want to have trained assistants, people who are comfortable with cat holding and blood drawing procedures. You want to comfortably position your donor, so let them get into a nice sternal position. If they're fully sedated, then you can move them to the end of the table and make sure you can really visualize their vein. But when they're kind of semi-sedated or conscious like Imola is, we just elevate the head slightly. We've used loads of local anesthetic cream, so she hasn't felt the needle, and we have our assistant who's holding her, who it's minimal restraint with our feline donors. We generally are just holding their head, trying not to hold it too high so it's not a really uncomfortable position for them, and we will do lots of head rubs and ear rubs and trying to keep them nice and relaxed. And often we'll kind of encourage their eyes to be closed. Cats, as probably we all know when nursing them, that what they can't see sometimes means that they don't get so angry about it. So actually if we kind of actively are kind of smushing their head a little bit and their eyes are closed, they generally relax a lot better. You need to have good aseptic technique. This is an open collection, so there's always a risk. You know, every time you're detaching that syringe, you want to make sure that it's being done as sterile as possible. You've got good hand hygiene, that the skin has been cleaned nicely. We tend to use a 21 gauge butterfly needle, but we have adopted a 19 gauge for some of our bigger Maine Coons, and it provides a really nice blood draw, but 21 gauge is absolutely fine. What we do find with the butterfly needles is they are pretty blunt. So some of our big tomcats that have come in, or those cats that have been neutered a bit late, it's like trying to get through a rhino skin. And once that butterfly needle's got through the skin, trying to then get through a vein is pretty difficult, unfortunately. And so local anaesthetic cream is an absolute must. But obviously, if they're sedated, it's less of an issue. These rubbish butterfly needles. And then your collection technique needs to be, the syringes need to be inverted as you're drawing them. So they need to kind of be mixing the blood with the anticoagulant as they draw, being mindful of not to kind of pull on the line or pull on your butterfly needle as they're kind of mixing the syringe. And needs to be a really steady pace. There's definitely a tendency to want to like, oh, the blood's coming really nicely, and you want it to be done, but it's really important that to not cause any kind of hypotension episodes in these cats, to just go at a really nice and steady pace. We want to avoid a forceful draw, as this can collapse the vein, and especially for those conscious cats, it can create quite a palpable flutter. The phlebotomist will feel it in the butterfly line. You'll see the line kind of vibrate a little bit. And especially as you're coming towards the end of the donation, you might find that the vein is taking a little bit longer to refill. So that last syringe might be a little bit slower, and you might start to feel the vein kind of closing as you're drawing, and you might just need to slow down a little. But smaller syringes, so those 10 ml syringes that we showed in the picture before, will reduce the risk of that vein collapsing. And again, with the cats, the big thing is minimize the noise and movement around them and any disruption throughout, because that's going to aid you in a much smoother and better kind of blood donation process. So as we said, it is an open collection technique. So there's going to be multiple exposures to the environments because of your syringe disconnection, when you're adding the anticoagulant in the first place, and this all contributes to an increased risk of bacterial contamination. So we really need to have strict aseptic technique. But what it also means is that actually that blood, therefore, is only suitable for the use within 24 hours if it's stored in a refrigerator. But if you're not putting it in a refrigerator, it's got 4 hours from the moment it's collected to be transfused to your patient. And that's the plus side of actually drawing it up into multiple syringes, is that you could start with one of your syringes and put all the rest of them in the fridge, and technically every syringe has 4 hours at room temperature to be transfused to your patient. As long as you get all of the syringes into transfused within 24 hours of being collected. Another trick is standing the syringes upright so that the plasma and red cells can separate from each other. So especially if you, like we described earlier, if you're giving AB cats type A blood, and you want to remove that plasma where all those anti-B antibodies might be, then stand your syringes up and it will encourage the plasma to separate. And then when you come to give that syringe, you just decant the plasma off and give the red cells. It won't be a perfect separation. You won't need to add anything to your red blood cells. There will still be a reasonable amount of plasma in there, but for reducing the kind of exposure to different components of blood that they don't need, if it's a cat that's purely anemic and doesn't have volume issues, then removing the plasma is going to reduce the risk of transfusion reactions, because you're removing a huge amount of blood product that's got lots of different components in it that they could react to. It's going to be removing potential antibodies, and it's going to be removing volume. We know that anemic cats have the potential for volume overload. They've been compensating, their heart's been overcompensating for the anemia, and so they're potentially already at risk of heart concerns and volume overload. So reducing that volume down is always going to be a good thing for your cats. And as we said, good aseptic technique to minimize this kind of bacterial contamination and make sure your blood products are as safe as possible. And I've added just a little slide on donation from IV catheters, because it's something that we have been doing for a couple of years now. And it started when I had a big cat who came in, and she decided that was the day she didn't really want to stay still for a jugular donation. I couldn't sedate her because her blood was going to be for stored donation, so I was all ready to kind of send her home. And then I needed to take some blood samples from her for her annual, so I took it from her IV catheter, and her blood flow from her IV catheter was amazing. And I was like, oh, I wonder if I can take her blood donation from there. And sure enough, I was able to achieve a full donation very easily from her IV catheter using two 30 ml syringes, as you can see in these pictures. And so since then, when we've kind of had maybe either a cat that's done similar to that, where they've not really wanted to stay still for sternal, but they're quite happy to have fuss and love like this little guy, then we've adopted to see if we can do an IV donation. So we've taken it from their IV catheter, like Sam is here, just kind of eking it out. Or when we've been taking their annual bloods and their blood flow has come zooming out of their IV, and we're like, okay, why would we not try and do it this way when clearly they can have fuss and be really relaxed, and we've collected the donation that way. So it reduces the need for sedation in those cats that would otherwise have to have some. It reduces the restraint required, and the research that we've kind of collected on this, where we've checked the hemolysis of it, there's been no evidence of hemolysis. And we're hoping, when I find the time, that I will publish the data that we've collected on this, so that more people can potentially adopt this. But it is by no means a foolproof method. There has been several times when we've been like, oh, it's fine, we'll just go and collect it from the IV, and then we've barely got a drop out of it. And it doesn't matter on the size of the donor either. You think that it's like, oh, it's only going to be suitable for the big cats, and then it doesn't come at all, and then you have a 3.9 kilogram cat that's donating, and it comes really nicely from the IV. So it's always just worth a shot, and just to know that there is no evidence of hemolysis being collected this way, you can be rest assured that you might be able to do a donation this way. Post-donation, again, they need to have a blood pressure check. So unlike the dogs, we would always try and do a blood pressure check, and we actually try and do this before they donate as well, just so we kind of know a baseline value for them and what's normal. But afterwards, we would do a quick blood pressure check, normally from their tail, so that we're not upsetting them too much. We offer them food immediately post-donation. Cats are more likely to eat kind of straight afterwards, rather than kind of when you've tidied them up, moved them into their kennel, and everything's kind of more noise has happened. We will shove a little bowl of food underneath their nose pretty much straight away, and we get pretty good response from the cats for eating. They should rest, so go home and tell the owners to keep them indoors for at least 24 hours with a litter tray, really, just so that they can keep an eye on them and make sure there's no kind of lethargy post-donation. Again, check the site of donation, make sure they've not scratched at it, and there's no bruising. Cats bruise that little bit easier than dogs, so a little bit of arnica cream is always a nice thing to add. And we often send them home with some aftercare instructions as well, especially those that are doing their first donation, just the name of the vet and the nurse that were kind of involved, and things to look out for, and what to be concerned about, and when to call us if they need be. So now we'll just look at cross-matching. So we think about cross-matching, or the way to kind of describe cross-matching is we've got our type-specific blood. So we know we've got a type A cat, and we've got a recipient, and we've got type A blood, and we're wanting to check the compatibility between them, because what we also know is that there is multiple other blood types that we don't type for, that we don't know about, and also, especially with cats, naturally occurring antibodies to these other blood types that we don't know about. And so even when we're giving type-specific blood, and even when we're doing it as their first transfusion for cats, there is still that potential for antibodies to be there. And what we're looking at when we're doing a cross-match is we're mixing our recipient's blood with our donor's blood, and looking at what it's going to do and what it would do if it was in the bloodstream and if we transfuse that blood product. We use Rapid Vet H cross-matching kits. We've done a lot of research into cross-matching and found that these are actually one of the most accurate methods, and they're actually relatively simple to kind of perform. So as you can see in the picture below, we have 3 different tubes. The red tube on the right-hand side is a positive control. And so this is going to show you what an incompatible cross-match looks like. You've got a clump of red blood cells that are sitting above this gel column. So this is the gel column, and there's this clump of red blood cells that's sitting on the top. And that's because they've agglutinated. And that's what would happen if you had red blood cells that came into contact with an antibody. It would clump them together. If it was the specific antibody to that antigen, it would clump them together and cause this agglutination. And that's meant that these red blood cells were not able to pass through the gel column because they were so clumped and agglutinated to each other. And that's an incompatible result. Our negative control, this green tube, has shown how the red blood cells have been able to flow freely down to the bottom of the gel column because they didn't agglutinate, and that would indicate a compatible cross-match. This is our results tube. So the yellow tube is our result one. And actually, I probably should have chosen a much simpler one to describe, because part of this looks like it's compatible, but what you can see is that actually there is red cells that have not been able to pass through the gel column, and there's some that are still sitting on the top of the gel column. And that's the most important thing, is that there was some red cells that were so agglutinated they couldn't even start to pass through the gel column. And so that would indicate an incompatibility between the donor and the recipient, and we wouldn't transfuse that donor's blood to that recipient. So that's what we're talking about when we look at cross-matching. We're looking to see if there is going to be visible agglutination between the red blood cells of the donor and the plasma of the recipients, because we're thinking whether that plasma has that recipient has antibodies to the donor's red cells. So who are we going to potentially cross-match? Well, essentially any patient that has received a transfusion, or a red cell, I should say, really, transfusion in their lifetime before, that was over 96 hours ago. So we put in 96 hours because most literature would kind of describe 4 days, but we always were getting confused when it was like, well, it happened at 8 o'clock in the evening, so when technically is 4 days up? So we go with 96 hours. So 96 hours after that first transfusion, and then for the rest of their lifetime, they potentially have antibodies that have built up there that could cause this kind of incompatibility. So those are the patients that we should be cross-matching. Why are we doing it? We're doing it because they've been exposed to a foreign antigen that's potentially stimulated antibody production, and therefore they're at increased risk of an acute hemolytic transfusion reaction, and this happening within their bloodstream. We're also doing it potentially to maximize therapeutic response, because we're looking to transfuse blood that is compatible and is going to stay within their bloodstream for a long time, as long as possible, so we get maximum therapeutic response out of it. We don't want cells that are going to be actively destroyed and hemolyzed or clumping together. When should we be performing it? Well, as we said up here, we should be performing it on those patients that have had a transfusion after 96 hours after that transfusion. And I put a little star here as a caveat, because for cats, research really has suggested that where possible, cats should always be cross-matched because of that, those naturally occurring antibodies that they have, and the potential therefore, you know, with the MIC blood type and the FEAs, or the kind of new and newly described blood types, that we know that they potentially have naturally occurring antibodies for, and MIC had an acute hemolytic transfusion reaction on his first one. That ideally, where possible, we should be cross-matching them for all their transfusions, so that we can get maximum therapeutic response, and so that we can minimize the amount of blood transfusions that these cats have to have, because it is hard to get cat blood, and also it's we don't want them to be exposed to too many blood products. But there is problems with that, because there is lack of availability of blood products, especially for cats, and a lack of availability of donors, especially if they're a rare blood type. And so really, for those cats that come in and it's their first transfusion, but they rock up and they're type B, well, you're going to end up getting the only donor that we maybe have available that day. And so cross-matching just isn't going to be possible. And there might be time constraints. So, you know, if it is their first transfusion and you need to get that blood for them as soon as possible, then maybe you just haven't got time to wait to do a cross-match. But where it cannot be avoided is those ones that have had exposure to a foreign antigen before because of a transfusion previously. And if it was over 96 hours ago, then they are going to need to be cross-matched in all circumstances when receiving red cell transfusions. So let's try and put it into context a little bit, and we'll talk about a couple of cases that we saw in practice. So this is the beautiful Smokey. He presented with signs consistent of severe anemia. So he came into us as a 6-month-old kitten, but he was very pale. He was as white as his paws. He was very tachycardic. And for a 6-month-old kitten, he was really quiet and lethargic. And he had quite a significant gallop rhythm. I remember him coming in and he was just kind of slumped against his kennel wall. He had his head just kind of lolled to the side, leaning against the kennel, and not at all kitten behavior. So the diagnostic test that we did revealed that he had a severe non-regenerative anemia. His PCV was 10%, so not looking great, and it kind of explains why he was feeling so rubbish. But he also had a high number of Heinz bodies. So cats do have Heinz bodies are naturally found in blood smears of cats. Their spleen just isn't very great at removing them, but that's generally the kind of volume that you'd see as a maximum of really like 10% of their blood would have Heinz bodies inclusions. But Smokey had 68% of his red cells had these Heinz body inclusions. So it's this little lump or this kind of protrusion that's happening from these red cells, which you can see are kind of all over the place in the majority of his red cells. And what that is it's denatured hemoglobin, where a toxin or an insult of some kind has caused that, or ingestion of a toxin has caused that hemoglobin to have an insult. It's denatured, it's become very rigid and incapable of doing its job of carrying oxygen, and it's then starting to, it's so rigid it's starting to protrude out of the red blood cell. And what we've found really with Heinz body anemias is that the toxins that normally cause them are things from the onion family, so leeks, onions, garlic, and paracetamol in cats can cause it. Zinc can cause it. I once saw a dog that had eaten the buckle from his collar, and he had a Heinz body anemia because the buckle had contained zinc in it. So once we removed the buckle, he was fine. But in Smokey's case, he actually had a little bit of a taste for licking the powder off the owner's sour cream and onion curls, and it was a concentrated onion powder that he was licking off these crisps, and it caused this quite profound Heinz body anemia and his PCV to drop significantly to 10%. The other thing that we can see on his blood smear are ghost cells. So they are exactly as they sound. They are what used to be a red blood cell. They're now this hollow, translucent appearance of a red blood cell. So we know that there is some destruction of the red cells, and they're no longer viable. So what did Smokey need? Well, the first thing we need to do is blood type him. And luckily for Smokey, he is type A, and we know that 75% of cats are type A, which means we've probably got a healthy donor pool, and we'll be able to hopefully find him a suitable type A donor. We also know with him being a cat that he must receive type A blood. Do we need to cross-match him? Well, he's a cat, and we know that they have naturally occurring antibodies to other blood types that we haven't typed him for. So yeah, if we've got donor options and we've got multiple units in our fridge like we did that day, then yeah, cross-matching would be ideal for Smokey so that we can get him a compatible unit that is going to stay in his system for as long as possible. Especially because, as we described on the last slide, he's non-regenerative. So we want to be able to get control of that Heinz body anemia and give him a transfusion that's going to last. We did a cross-match. Our negative control here shows what a compatible cross-match would look like, and thankfully we got a really lovely result which looks very similar to that. No red cells up at the top like the incompatible result would look like. They've all been allowed to kind of flow through the gel column. So what blood product would be ideal for a cat like Smokey? Well, packed red blood cells ideally, because if we're looking at component therapy, we want to expose him to the least amount of a foreign blood as possible. And so he is a cat that is purely anemic. He doesn't have volume issues. He doesn't need platelets. And so we want to replace like for like. He needs red blood cells that don't have Heinz bodies. And so we would like to give him packed red blood cells. However, if we were having to call a donor in on demand or in general practice where we don't have kind of stored feline blood products, then fresh whole blood would be a totally viable option for him. It's going to give him the red blood cells that he needs. And yes, it will have, he will be exposed to kind of the plasma as well, which could cause him to have, transfusion reactions from the contents of that. But we could do that trick of sitting up the syringes and removing as much plasma as possible, which would also help us with kind of the volume. He's a small kitten, so we want to transfuse him with as lower volume as possible. But both of those are great options. Our gold standard one would be packed red blood cells, if not fresh whole blood, and try and remove some of the plasma. And maybe we could give him a xenotransfusion if we didn't have either the time or we didn't have the donor options to give him feline packed red blood cells or feline fresh whole blood. A xenotransfusion would be an option. So when we talk about xenotransfusions, we're talking about interspecies or cross-species blood transfusions. And in this situation, we would be talking about giving him dog blood. The really important thing to know about a xenotransfusion is it is a one-time procedure. They can only have this once in their lifetime and never again. all research that has been done on, sadly, some horrible research that was done on cats looking at xenotransfusions showed that all subsequent second xenotransfusions resulted in death. So it is an absolute no-go for them to have it again, but it is a life-saving measure for that one-off occasion where they can have, if we've not got time to wait for a donor to come in or we don't have any donor options, yes, a xenotransfusion would work for Smokey. It would buy him some time, but the likelihood is, with him being non-regenerative and cats being lazy when it comes to regenerating and it taking a good few days for that to kick in, he might still need feline blood anyway, but it might just give you that time to locate a donor and source a donor for him. But a xenotransfusion, the median time that they're kind of average it's going to stay in the system is 2 days. People used to think it would stay in the blood a little bit longer than that, but it doesn't, and sadly. And I've actually seen some cats that have started hemolyzing it within 24 hours. It really does trigger, it will always trigger a hemolytic reaction, but sometimes it's acute and it can happen within the first 24 hours of them being exposed to that blood. So it is not a benign procedure, but it has its place in veterinary medicine, certainly, for those kind of life-saving moments where there isn't time to wait, and they've never had one before, so it's going to buy you some time. How much would we give him? So if we're looking at packed red blood cells, we would be looking at the calculations here. So we'd want 1.5 mils of packed red blood cells times the desired PCV rise that you want, and then times it by his body weight. I can guarantee you that you'll come up with a really lovely number of, I'd like 40 mils of feline packed red blood cells to increase his PCV, and that's just not going to happen from one unit. So the desired volume, unfortunately, often doesn't match up, but it's always useful, especially with your smaller kittens, to do this calculation, because you want to look at kind of getting the right volume where possible. But more often than not with cats, sadly, we don't, with feline blood products, we don't get the volume that we want or the PCV increase that we'd love to have, but we get something, and that's the main thing. And then if they're fresh whole blood, because obviously it's not as concentrated, it's actually going to be 2 mils of fresh whole blood times the desired PCV rise you want times their body weight. But what he actually needed was Theo. So thankfully, this beautiful Maine Coon Theo, one of my absolute favourites, he always kind of needs the bedding during his blood donations and purrs, and he's just absolutely dreamy. He'd come in and donated a few days earlier, so there was a lovely unit of Theo blood, Theo packed red blood cells sitting in the fridge that were lovely and compatible with Smokey. And because he had a cross-match compatible unit of feline packed red blood cells that were freshly collected, that was the only transfusion he ended up needing. So let's look at a dog. This is Tilly, our lovely Springer Spaniel. So Tilly was brought in actually by her owner, who was a vet, and she had noticed that she had oral hemorrhage and some petechial hemorrhaging, and she was a bit lethargic for how Tilly normally is, springing around. And so she did some in-house tests and found that she had marked thrombocytopenia. I think she didn't see a platelet on the smear at all, but she had a PCV of 45%. So didn't look too scary at the time, but she, with her owner being a vet and having the knowledge that she did, she knew that this was probably going to deteriorate pretty quickly. Unfortunately, spaniels seem to get immune-mediated diseases worse than other dogs, and so I think having that knowledge and knowing her Springer Spaniel now had thrombocytopenia, that it was probably going to progress pretty quickly and she was going to need some blood product interventions at some point. So she came over to us. And sure enough, not long after being with us, we noted that she had melena. What we know about thrombocytopenic cases generally is that they get through a lot of blood products. Especially if they start to get gastrointestinal losses as well, it can be pretty profound volume that they lose, and we get through a lot of blood products with these cases, and especially when they're spaniels, unfortunately. And that PCV dropped pretty quickly. So 48 hours afterwards, it was down to 17%, and she wasn't coping very well. She was very pale and very lethargic and feeling pretty rubbish. So what did she need? Well, as suspected, quite a lot, actually. So we blood typed her, as we should. And thankfully, again, for Tilly, she was DEA1 positive. And we know that 60% of dogs carry DEA1. So we should have a good chance of getting her DEA1 positive donors. No need to cross-match her. This is her first transfusion. She's a dog, so she doesn't have significant naturally occurring antibodies. So we're going to give her type-specific blood. She's positive. We've got lots of positive donors, but we're not going to cross-match her. But actually, the blood product that we're going to choose for her, and then thinking about kind of components and component therapy, we're actually ideally going to get her some fresh whole blood. So we're going to call Calypso in, one of our beautiful Labradors. And Calypso came in and donated fresh whole blood for Tilly so that she could have the platelets, she could have the volume that she needed because she was losing quite a lot of melena and losing whole blood. So it was giving her the red cells for that anemia, the plasma for the volume depletion, and maybe some of those platelets would stick around long enough to plug a few gaps. And that's exactly what happened, is she did plug a few gaps, and actually that fresh whole blood stayed in her system quite a while. With the dogs, these calculations are actually really useful. So with the cats, like we said, often you get this like lovely number and you're like, I'm never going to be able to get that volume of cat blood to give you, but we can dream. But with the dogs, these calculations are really quite important, and they really will help you to kind of calculate what volume of blood product would be beneficial for your patients. And so we calculated with her for this 2 mils of fresh whole blood per desired PCV increase. And actually, she did really well for 6 days, and we were really hopeful. But she is a spaniel, and so she was really struggling with this immune-mediated thrombocytopenia, and she did need some more blood again, and she's now in cross-match territory. So at this point, because we're looking at cross-matching, we're not going to call a fresh whole blood donor in. That would be ideal, again, because it really did make a good difference for her for a few days. She held on to a few platelets by the sounds of it, or it plugged a few gaps. But because we're looking at cross-matching, we don't want to call donors in and cross-match and then find it's incompatible. So we're going to go through the fridge and look at our pat red blood cell units and cross-match her with those. And thankfully, she was compatible with some of our donors, and we were able to give her what she needed. And then we're calculating now based on pat red blood cell volume rather than the fresh whole blood calculation. And luckily she was compatible with both Lulu and Higgins. And actually what's useful to note now, based on kind of looking back on Tilly as a case, was Calypso actually, one of her next annual blood tests revealed that she had, I'm trying to remember what it was, but I think she tested positive for Bartonella, maybe. And so we screen our donors every year, and I actually think it was the first time, I think it was when we just introduced screening them for Bartonella, and so she'd never been screened for it before, and her first time of screening her, we discovered that Calypso sadly was a carrier of Bartonella. And so we did actually have to screen Tilly for this as well. But had we had obviously now we're going to be using the HORIBA, the pocket PCR analyzer, we would have had those results within the same day, which would make a big difference for these kind of cases, because Calypso had donated fresh that day. We'd sent off the bloods and we didn't get them back for 5 days. And actually luckily she didn't actually seem to contract it, but we have had cases before where sadly cats, particularly with mycoplasma, we have transfused mycoplasma positive blood, and subsequently the recipient has got that as well. Luckily it's treatable, but Calypso is now a retired blood donor, unfortunately, but it was worth noting and something interesting on hindsight with Tilly's case. So how did we set them up for these transfusions? So firstly, we want to start a transfusion slowly. We're always going to start at around 1 ml per kilogram per hour. And actually, some people would start even slower than this, but actually you're barely going to get through the IV catheter before you're having to kind of stop and do a TPR. So we would say start at 1 ml per kilo per hour, whether that's a dog or a cat. And that's for the first initial kind of 15 to 30 minutes, 30 minutes ideally, unless you really need to start increasing that volume up if they're not doing too well. Your baseline values need to be obtained just before the start of the transfusion. We don't want to be using TPRs that we collected 4 hours earlier, when all manner of things could have changed in between then and the transfusion starting, and you don't know that they're actually become pyrexic in that time, and then you start the transfusion and you're like, oh, they're now pyrexic, and you're thinking it's the transfusion that's caused that, but actually it was because it was an old baseline TPR. So Take it just before the start of the transfusion, and then every 15 minutes for the first hour, and then reduce down to every hour thereafter for the remainder of the transfusion. Your transfusions want to be completed within 4 hours if that blood product is at room temperature. Anything after that, you're going to start risking bacterial contamination of your unit. However, you can split your unit, even dog blood, so you could put an injection spike in your unit of dog blood and draw out what you need into syringes, and then you have 4 hours for each syringe that's at room temperature, as long as the rest of it is used within 24 hours. So then you can go at a rate that's more comfortable for your patient. Always check the IV catheter and give it a good flush and check its patency and check that everything's connected. There is nothing more painful than seeing a transfusion going into vet bed. And we always have to use blood-giving sets or hemonate filters for transfusing blood products. This is a hemonate filter that we use when we're delivering blood products through syringes and syringe drivers, and it acts like the filter that you get in your blood-giving sets. So blood-giving sets are different to normal ones. They will have a little filter in the drip chamber, and that's there to collect any blood clots or flocculent material that you don't want going through into your patient's veins. And this little inline hemonate filter acts in the same way. You want to check that your fluid pump and your syringe drivers are compatible with blood products. We shouldn't be putting blood products through for fluid warming pumps, but most of our machines now are compatible, but you always need to check, because you do not want to be transfusing a blood product through an incompatible pump. That's going to hemolyze your red cells as they pass through. And whilst the transfusion is underway, the things that you should be monitoring and looking at kind of at these 15-minute and hour checks are also things like their mentation. In people, one of the first things that they describe happening when they're having a transfusion reaction is a feeling of kind of worry and depression. It's like a feeling of kind of impending doom, as way one person described it. And so I think it's really important to kind of keep an eye on their mentation. Nurses are very good at being able to know a patient's behavior and be able to recognize when they're changing. So yeah, it's always really important to keep an eye on that. The mucous membrane color, to check that it's not suddenly becoming icteric, which would indicate the unit is, the transfusion is being hemolyzed. And so you need to know what it was before and what it is now. Their general appearance, to make sure that they're not kind of getting any rashes or facial swelling. And then urine and serum color, again, indicators of hemolytic reactions. You're looking for the urine color to be kind of getting pigmented, and then the serum color to be looking hemolyzed, are really strong indicators of quite severe reactions that would indicate a transfusion needs to stop. Signs of a reaction would be, the most common one is an increase in temperature. So a febrile reaction, where you get a temperature that goes above 1 degree above their baseline, but it also is only when this increase takes them to a temperature over 39 degrees. A transfusion is naturally going to increase and improve perfusion. So if you have a cat or a dog that's temperature was maybe a little low to start with, and they start to climb and you're thinking it's a transfusion reaction, but it's still within kind of a normal acceptable temperature range, then it could just be that they're better perfused. But actually, if it goes over 39 degrees, then yes, you should be looking at that as a sign of a reaction. As we described, icteric mucous membranes, icteric or hemolyzed serum, hemoglobinuria, like this delicious picture here, tachycardia, tachypnea or dyspnea, altered mentation, like we said, or restlessness. People said they could definitely recognize that they felt unwell, and we have to assume that dogs and cats can kind of recognize when they're feeling like that as well. So anything like that might be an indicator. GI disturbances, especially kind of vomiting, hypertension, urticaria, and facial swelling. These things are often really seen with plasma transfusions as well. Facial swelling especially is something that we experience quite a bit with plasma reactions. So what should you do if you suspect a transfusion reaction? First thing that you immediately need to do is pause the transfusion and have a chat with a clinician about what to do next. Then you want to assess the serum and urine for evidence of hemolysis. That's the big thing that you're worried about, that there is an incompatibility happening here and hemolysis is starting to happen. Examine the blood product for any signs of discoloration, whether it looks like pearlescent or really dark. They can be indications of bacterial contamination. or abnormalities in just the general appearance. If you notice any blood clotting, that can be signs of bacterial contamination too, and check the expiry dates. You can do a blood smear of the blood product to check for any evidence of bacteria if you're suspecting a septic transfusion reaction. You should administer flow, oxygen by flow during the assessment as well, especially if you're suspecting that there's circulatory overload or acute lung injury. But if the patient and the clinical signs become stable, the temperature increase is limited and it's less than 2 degrees, and you've ruled out an acute hemolytic transfusion reaction or a septic transfusion reaction, then you can restart the transfusion and monitor them closely. But if any of those things start to happen again and you've got that increase in temperature or any other worrying signs, then it might be that that transfusion just can't be completed. Thankfully, both Smokey and Tilly are now at home. They made a full recovery and they're doing really well. And that's it from me. Thank you so much for listening. I hope you found it useful. And if you have any questions, then I'll stay on.
Thanks so much, Charlotte, for that. Absolutely brilliant presentation there. I've got so many notes in my book here. Everything that you've mentioned has rung true, I'm sure, for me and for everybody that's signed in with us this evening. So if you do have any questions for Charlotte following the presentation, you should have a questions box on your screen. Please feel free to pop your questions into the chat there, and Charlotte's very kindly agreed to stay on and to go through those with us. So some really good practical points there, everything from how to keep your patients happy, lots of kisses, bedding to provide, positioning, all the way through from that to how to then administer your blood products following and how to do that safely. I think this week it's been interesting. I hadn't realised very appropriately that it's organ donation week. So I've been for many years now a blood donor and also registered as an organ donor. So quite appropriate that we've got that on the same week. So if anybody's thinking about blood donations themselves, they can also sign up for that and be an organ donor too. Interesting to hear about the advances in blood typing still now going forwards, that we've still got things that we're finding out about blood transfusions and how to do them safely and to avoid those issues that people might see with cross transfusion issues. Okay, so I'm just going to have a quick look and see if we've got any questions come in so far. We have had some requests for CPD certificates, so yes, of course, we will be very happy to send those on afterwards. So if you do want a CPD certificate, if you've signed in live this evening, pop your details into the questions box, and we'll ensure that those get sent on to you very soon. So lots of compliments there for an amazing presentation. I can only echo those. Charlotte's obviously very passionate about what she does, very knowledgeable. So we've been very pleased to have her join us this evening and to share her expertise. So loved it, amazing. I was very outdated with some of my knowledge. Are there any practical training courses with transfusions? So as we know, Charlotte's working at RVC, where they perform this service, and it's only one of a very few numbers of dedicated blood transfusion services that are available. So Charlotte, if you have any information about practical courses, then perhaps you can help by sharing that with us. Some more questions coming along. Please keep adding them in and we'll go through them all. So Charlotte, if you're able to tell us, there is a question here about the pet blood bank service, which I know is separate to you, but that's asking about volunteering with blood bank. Do you know if that's something that's available?
I don't actually. I think they do have volunteers that go out. I mean, I think they're generally based a little further up the country than I am, but I think the best thing to do would probably to send them an inquiry because I'm not sure whether it's kind of on a more permanent basis that people sign up and volunteer. Having said that, I do know that they obviously go to general practices across the country and use the facilities there to perform the blood donations. So if you're working in a practice and your clinic was to sign up to be a centre where they could run blood donations from, the staff who work within that hospital are often able to kind of help and assist with the blood donations. I know Willows, where I used to work, they run regular blood donation sessions with Pet Blood Bank, and I've often seen pictures of some of the nurses that work at Willows assisting with that. I think they've really enjoyed it. So maybe see if your practice can sign up.
Okay, that's brilliant. Thank you for the information. I think, perhaps the best thing there is to contact Pet Blood Bank directly. I know they're always very helpful when I've interacted with them at different CPD events. They have also additional resources available that individual staff and practices can use. So I'm sure they would welcome the inquiry. Any practical courses that you're aware of, Charlotte, for more hands-on training to do with blood transfusions?
No, at the moment, I don't think there is many practical training courses. I was trying to run a course, and I'm still looking into it, so that we could do a more kind of face-to-face training, so an in-person CPD day. And we were looking at being able to do some blood typing and cross-matching practicals within that. So maybe a bit of a watch this space type thing for something like that. But at the moment, not that I know of, I haven't seen any practical sessions running.
Okay, thank you. Perhaps that's something to take back to your colleagues at the RVC if there's demand there for that kind of a service. It looks like it's been, a very popular topic this evening that people have shown great interest in. And I think there is, from my experience working in practice from quite some time ago, in fairness, but it's something that obviously is life-changing for patients, but can be quite a daunting task. You and the team make it look very, very easy. I've had the pleasure of going into the new blood transfusion centre at the RVC actually just yesterday, and it's an amazing setup there, and they work incredibly hard, as Charlotte's demonstrated, to make the patients comfortable, to have a quiet and calm environment. Their knowledge is phenomenal. And trying to replicate that in a practice isn't easy, but as Charlotte's demonstrated, by following her advice, it's not impossible. So you can replicate that in practices. But I guess it looks like there are people who'd like to know a little bit more even than we've shared today. Charlotte does speak, and there are other, obviously, resources available around blood transfusion medicine as well. So yeah, we'll watch that space, and if we do hear of any practical sessions coming up, we'll be very happy to let people know. We did have another question come through about a slightly more technical question. What are the cut-offs for haemoglobin for transfusion, or is it more on the clinical picture? So what would your advice be on that, Charlotte?
Yeah, absolutely. It's going to be more on the clinical picture, mainly because of availability of blood products, and often it's dependent on how chronic the anemia is as well, and how well they're coping. So I've seen cats come in with a PCV of 5% and they're still grooming themselves because that anemia is so chronic. They've become quite stable, but often what we find is that we'll just have to monitor their clinical signs, and if we see a PCV that we're kind of is unsettling, it is put together with a clinical picture as well, and then we can kind of utilize blood products in the most appropriate way. We're very mindful about, especially with cat blood, it is such a precious resource, and we're trying to make sure that we have enough blood products available for all the animals that need it. And so yeah, there is often a good discussion about kind of at what point we intervene with blood products, and but we try not to kind of hold back, and we obviously don't want anyone to suffer. And things often that we find that people wouldn't even think of as clinical signs are things like inappetence. So we can have cats with a PCV of maybe 12 and they're coping quite well, and we're thinking, and they're eating and they're doing well, and then even just their PCV doesn't dramatically change, maybe it's only dropped by 1%, but they've stopped eating. That can be quite an obvious sign that actually that animal isn't doing as well as you think, if they were previously eating quite well and they were quite happy. So it's even signs that you wouldn't think of. Obviously there's the obvious tachycardia and kind of respiratory concerns, handling them, they kind of decompensate really quickly, and that's how you know they're not coping. But there's subtle signs that start to happen before even that, and that's often things like anorexia and things like that. So yeah, it's not normally a number.
Sure. Okay. So it's looking at the bigger picture then, and that's kind of reminded me of a point that you made when we were looking at the cats as Smokey's blood. So obviously you'd taken a sample for a smear for that, which can be so important in looking at the clinical picture as well. So when you've got that anemia, is it regenerative? What's the bigger picture there, which will obviously help with deciding if you're going to give whole blood products or something different.
Absolutely. The regeneration status is something that we're always, the vets, when they come and speak to us and request blood products, we're always like, have you done a blood smear? What's the regeneration? Because then you really know how immediate that blood transfusion is. If you've got a cat that's, yes, PCV is not looking great, but they were really regenerative, you might be thinking, okay, well, maybe if we don't do too much handling and there's nothing, we can sit and wait, and maybe that they'll start to pick their own up a little bit. But like Smokey, if they're non-regenerative, really lethargic, tachycardic, then you know that really waiting isn't really much of an option, because they don't look like they're showing any signs of being able to do it themselves.
Sure. I know we've got some haematologists in the audience who'll be very happy to hear about the blood smear and how very important that is as part of a diagnosis and a treatment plan. Just leading on from that as well, around the PCV, we've got a question. So it says you gave us 2 happy stories. Of course, it's brilliant that they had 2 happy endings, but we don't always get that joy with cases. So the question is then, where do you lean on euthanasia instead of transfusion? What would be your criteria or decision-making process around that with cases?
We have, we're really fortunate that we do have kind of multidisciplinary discussions about those cases that are starting to cause for concern about kind of where we stop with how many transfusions they're having. We actually had a case discussion this week on one of our cases that had multiple blood transfusions because of a thrombocytopenia, and that they are difficult to kind of decide at what point you withhold blood products or what time it's time to kind of stop. Often, it comes down to a multidisciplinary approach where we all kind of discuss the case and decide where we're going. Are we seeing any signs of improvement? Obviously, sometimes, sadly, there's cost concerns as well. The good thing about our service is we're non-profit, so we don't make any profit from blood products, as that would be, we would consider that very unethical with these animals donating this blood. So everything transfusion-wise is as cost-effective as it can be, and it's at minimal cost, hopefully, to the patients needing it. But having said that, even if it's deemed as maybe an affordable blood product, it still is coming from an animal has come in and donated that blood and didn't necessarily need to have a needle stuck into its jugular and come in and donate a pint of blood. And so we always are very considerate about whether it's ethical, whether the prognosis of that patient that's receiving that blood it's adequate enough to kind of justify doing it. Those are always questions that we have at the forefront, and we always make sure that we're considering that and decide on euthanasia when it's appropriate rather than give blood products.
Okay, that's great, thank you. And I think that's really valid to also mention, obviously, the care of the donor animal as well as the recipient, and that can be a really tough decision to make. So having a discussion amongst colleagues about the risks and benefits that you're facing, and coming to a consensus, of course, with the owner's wishes and needs borne in mind as well. I think that's a very logical approach. Thank you. We have a more technical question now. So regarding xenotransfusions, if you gave a cat DEA1 negative blood, could you not then give DEA1 positive blood after, or would this always result in a lethal transfusion reaction second time around?
So it's actually interesting. I asked this question to the Karen Hum, the director of the transfusion service, because I was kind of under the same, I was like, well, maybe we just go with a different blood type. And actually, I think research, this is kind of as far as I know, and I may be slightly incorrect on this, but I don't think it mattered. In the transfusion research and the xenotransfusion research, that was, you know, the kind of, sadly, the quite horrible research that was conducted on this. It didn't matter which blood type it was. I think that there was, and what we've actually found as well with the cats is that some of them have had acute hemolytic reactions during the xenotransfusion. So, and we haven't really been able to explain that yet, because they obviously are not born with naturally occurring antibodies to dog blood. I don't think cats ever thought that humans would get involved and start giving them dog blood, but they have had acute hemolytic transfusion reactions, and so we have to think that maybe they have antibodies that recognize or potentially that the dog blood groups are targeted by kind of similar antibodies. We don't know, but what we've kind of found is that it didn't really matter whether you gave different blood type the second time round, it still ended up being quite disastrous.
Okay, so difficult research to think about carrying out, but perhaps not one that we would risk now, you know, with ethics concerns around research. So interesting logic, but I guess we're probably not happy to take the risk with that in most cases then. Okay, a further question, and I do appreciate that we've run over a bit this evening. We normally aim to finish within about an hour and a half, but Charlotte's very kindly agreed to stay on and answer any further questions. We're drawing to the end of them now, but if you do have anything else that you would like to ask this evening, please pop your question into the chat box now, and we will cover as much as we can. We have a question: how do I find out which practices will do transfusions? Obviously, we know that you do it there at the RVC. Is there a register or list, or would that be a matter of just investigating locally?
Yeah, so the Pet Blood Bank, in terms of canine blood products, they are a blood bank that supplies blood products to practices across the country. So essentially, any practice in the UK can perform a blood transfusion and get a supply of canine blood products within the day, within a few hours from Pet Blood Bank. It's a fantastic service that is across the entire UK. Unfortunately, there is not a feline blood bank in the UK as of yet. It's a bit of a watch this space. They are trying, and so at the moment, for feline blood products, it would be a case of the RVC where I work is one of the only places that kind of has a dedicated transfusion service with a significant kind of feline blood donor pool of donors that come in. But obviously we're in the south, and so we aren't accessible to everybody in the country. But general practices and referral hospitals across the country deal with anemic cats every day, and they will have their list of, they will have small lists, but they will have lists of donors available, and it's more of an on-demand kind of donation when those cats present to the hospital. But unfortunately, we are the only place really at the moment that has kind of blood products available for cats. But dogs, it's a much easier picture. Thanks to the Pet Blood Bank, most practices can sort that for you.
Okay, that's really helpful, thank you. So a couple of options nationally, but then perhaps a little bit of investigation locally if you're looking for something that's accessible. One question that's also come up, Charlotte, is we heard about feeding animals after donations. What's the practicalities around feeding before? I know you mentioned about cats having sedation before, so maybe not appropriate, but when people go for blood donations, you always meant to have a drink first and have had some breakfast. So is that the same for our pets?
Yeah, so we do actively try and encourage the owners, especially with the dogs, to kind of hydrate them where they can. It's not as easy as it is with people, where we know what we're doing, and you tell a dog to drink when you want it to, and it turns its nose up. So, but what we normally suggest to the owners is that, especially if they are a planned donation and it's not something that we're calling them in for an emergency, when they know they're booked in, if they can just start adding a bit of water to their food. So that's a way of sneaking some extra water content into our donors before they come in, without them being any the wiser. And then just, being more, especially in the summer, we actually cancel a lot of our donations when it's really hot, because we can't actively kind of force them to drink before they come in, and we want them to be, we worry about kind of the kind of risks in the summer. But yeah, we will ask the owners to add water to their food, give them wet food in the days leading up to coming in. And yes, with cats, we know if they're going to be sedated donors or not. So because 95% of the donations that we perform here on cats are conscious blood donations, so they can eat right up until them coming in, and we give them treats before they're donating. And but if they are being sedated, then yes, we would normally advise for a few hours, only really a maximum of kind of 4 hours before coming in, to withhold food from them. We don't suggest that it needs to be anything longer than that, but they do need to be starved for sedation.
Okay, no, happy donors all round then. So that's great, thank you. I think one of the things I took from the talk was certainly around when sending animals home, that you have the checklists for the owners, but for anybody working in practice who's beginning to undertake transfusion, or indeed has been running them for a while, but having your checklists, you've provided us with some great resources here, Charlotte. And for anybody who hasn't noted down everything, the webinar will be available to view back shortly. So if there's anything that you've missed or didn't quite catch the first time round, you will be able to see back. But having your checklist for everything that you need to have ready beforehand, everything that you need to monitor during and afterwards, making sure you've got a really good, thorough SOP will ensure that the success of your transfusions. So we are drawing to a close now. I don't think we've got any more fresh questions come in. If there is anything else, then pop it in really quickly now. I just need to do some thank yous again to Charlotte for her time and her presentation. And thank you for mentioning the HORIBA product as well, which was an aside. We didn't ask Charlotte to do that today, but we are thrilled that we're working with the transfusion service at RBC to enable them to test for some of these infectious diseases and parasites very quickly, which will remove the risk of those things being transmitted as part of a transfusion. Thank you also to the HORIBA team who work in the background in getting the publicity out for the webinar, and for giving up their time in the evening to set up the recording and do all the technical stuff in the background. These things don't happen easily, but my team make it very easy, so thanks to them. We have some more CPD coming up soon, so keep an eye out for that. There'll be another webinar coming up before too long, and we're also attending some further events coming up soon. We will be at the Southern European Veterinary Congress in Madrid in October, and at London Vet Show in November this year. We will be showcasing our brand new haematology instrument that's coming, and also the PCV system, the Pocket Central will be there as well if anybody wants to come and have a look and find out about more fast PCR testing. So no more questions come in. So that leaves me just to say a final thank you to Charlotte. If there is anything that springs to mind, you will have our email addresses available via the recording. You can see those there, or come and see us at one of the events coming up soon. We'd be lovely to have a chat with you in person. So thanks to everybody who's tuned in this evening after a day at work, or if you're watching that later, thank you for joining us, and enjoy the rest of your evening and your day. Thank you.